Hello, my name is Florida Lewis. I have been assigned by Ashford University Hospital to make out a compliance plan for the employees. My duties and responsibilities include overseeing and monitoring the implementation of the compliance program to ensure compliance with the law. With the advice of legal counsel, supervise the preparation and development of guidelines on specific federal and state legal and regulatory issues on matters involving ethical and legal business practices. Also, I insist in establishing methods to improve the Ashford University Hospital efficiency and quality services and reducing the hospital vulnerability to fraud, abuse, and waste. I also revise the program periodically to include the changes of the laws and regulations and procedures of the federal, state government, and private payers health plan. I also will develop, coordinate, and participate in various educational and training programs that focus on the elements of the compliance program, ensure that all appropriate employees and management are knowledgeable of and comply with pertinent federal and state laws and regulations. My duty also includes I will ensure that all independent contractors and agents who furnish medical service to AU Hospital are aware of the requirements of the compliance program with respect to coding, billing, marketing, referral, and kickbacks. I will also coordinate with departments of human resources to ensure that no employees have been excluded from participating in any government health plan. And I will plan and oversee regular periodical compliance audits of AU Hospital operation in order to identify and rectify all possible barriers to the efficiency of the coordinates program. My first plan that I will put into practice will be written policies and procedures. And those are standards of conduct for all AU hospital personnel. Employees are expected to follow the standards set forth in this compliance plan, as well as all applicable laws. Employer will conduct business and personnel activities with the highest level of integrity. No employer shall make, file, or use any false, fictitious, or fraudulent statement on documents in connection with the delivery of or payment for health care benefit items or service. Also, no employer shall falsify, conceal, or cover up a material fact in the performance of their duties. Employees will possess the necessary skills, quality assurance process system, and appropriate procedure to ensure that all billing for government and commercial insurance programs are accurate and complete. Compliance number 2, HIPAA. AU hospital personnel will comply with requirements as mandated by HIPAA training. There are essentially 3 areas of the HIPAA compliance concern to AU personnel. The first one is privacy. AU hospital personnel may not use or disclose protected health information, PHI, unless the patient had authorized or consented, unless HIPAA specifically permit or required. HIPAA permits AU hospital personnel to use or disclose PHI without patient consent only for payments and healthcare operation. The next one is security. AU hospital personnel will ensure they do not disclose information that can compromise the security, confidentiality, or integrity of personally identified information. AU personnel will adhere to AU hospital established policies and procedures and administrative, physical, and technical control to ensure protection of PHI. Standard electronic transaction. All AU hospital personnel will adhere to HIPAA requirements that providers doing business electronically will use the same standardized healthcare transaction code set and identifiers. Standard transaction for electronic data interchange to transmit healthcare data includes claims and accounting information, payment and remittance advice, and claim status and inquiries. Compliance element number 3, conducting effective training and education. An initial compliance training. All new employees involved with the AU hospital process will receive an initial training session that will cover the topics and guidance set forth in this plan before they begin their assigned duties. Statement acknowledging employees' commitment to and receipt of the compliance plan and code of conduct will be signed and dated and remain in the employer's personnel file. Annual compliance training. All personnel will attend training on an annual basis, including appropriate training in federal and state statutes, regulations, and guidelines. An ethics session will emphasize the organization's commitment to compliance with these legal requirements and policies. Compliance programs summarizing fraud and abuse statutes and regulations, federal and state, code and requirement, claim submission process, and employer's code of conduct statement. Acknowledging employees' commitment to the code of conduct, updated as needed, and retaining an employee's file. Okay, Nick. Mm-hmm.